Hi guys, welcome to my YouTube channel. If you're new to this channel, please subscribe and turn on your notification bell so you are going to know whenever I drop a new video. After subscribing, put it down in the comment section by writing I subscribed so that you will be appreciated. And to my wonderful returning subscribers, I just want to say thank you. In today's video, we'll be talking about a disease condition known as cerebrovascular accident, aka apoplexy, aka stroke, which is the common name. Some people still believe that stroke is being caused by juju, or when two people are dragging land, it can be invoked. But no, it is caused by decreased blood supply or blood flow to the brain. So make sure you watch to the end of this video because I'll be talking you through the causes of stroke and factors that can predispose you to this disease, which are modifiable. Stroke occurs when the normal blood supply to the brain is interrupted, and it can be divided into two categories, which are ischemic. It takes 85%, and when I say ischemic, I mean when there is deficient supply of blood to a body part that is due to obstruction of the inflow of arterial blood. So in ischemic stroke, there is vascular occlusion and significant hyperperfusion occurs. The second one is hemorrhagic stroke, which takes 15%. So hemorrhage means a heavy discharge of blood from the blood vessel. So ischemic stroke can be caused by the following: large artery thrombosis, small penetrating artery thrombosis, cardiogenic emboli, cryptogenic origin, that is idiopathic, it's unknown, another stroke which are caused by cocaine use, coagulopathies, spontaneous dissection of the carotid or vertebral artery, and hemorrhagic stroke can be caused by intracerebral hemorrhage, subarachnoid hemorrhage, cerebral aneurysm, and arteriovenous malformation. Large artery thrombotic strokes, from the name, you know that it affects large artery. So it is due to atherosclerotic plaque, that is abnormal fatty deposits in large artery or large blood vessel of the brain. So there is thrombus formation, which is blood clots will now appear in that place. There is fatty deposits, which is caused by high cholesterol level or hyperlipidemia, and it will now lead to occlusion, which now lead to ischemia, that is deficient blood supply to that particular place, and eventually lead to the death of the tissue the vessel is supplying blood to. Small penetrating artery thrombotic stroke, which is also known as lacunar stroke because cavity is formed when this infarcted brain tissue, infarction means dead tissue, disintegrates, that is when they divide, a hole is formed, which is known as cavity. In cardiogenic emboli, an embolus is an abnormal particle such as an air bubble circulating in the blood, and it can be seen in cardiac dysrhythmia, which is seen when the electrical activities of the heart is recorded. There is abnormal rhythm of the heart, and in atrial fibrillation, which is a very rapid irregular contraction of the muscle fibers of the heart, resulting in a lack of synchronism between heart and pulse. So this emboli originates from the heart and circulates the cerebral vasculature. It affects the left middle cerebral artery most, leading to stroke. In cryptogenic stroke, it has no cause. It is idiopathic, and other stroke can be caused by cocaine use, migraine, which is a condition marked by recurring moderate to severe headache with throbbing pain. It begins with one side of the head and might spread to others as it goes on, and coagulopathies and spontaneous dissection of the carotid and vertebral arteries when they separate. So it can lead to ischemia. Coming to the causes of hemorrhagic stroke, the first one is intracranial or cerebral aneurysm. It is the dilatation of the walls of a cerebral artery that develops as a result of weakness in the arterial wall. The cause of aneurysm is unknown but may be due to atherosclerosis, that is a condition marked by atheroma, when there is abnormal deposition of fatty tissue, which now result to a defect in the vessel wall. It can also be caused by hypertensive vascular disease when there is head trauma or advancing age. Another cause of hemorrhagic stroke is arteriovenous malformation, abnormality in embryonal development that leads to the tangle of the arteries and veins in the brain without a capillary bed. The absence of a capillary bed leads to dilatation of the arteries and veins and eventual rupture. They are commonly a cause of hemorrhage in young people. So in subarachnoid hemorrhage, that is hemorrhage in subarachnoid space, it may occur as a result of this AVM, which is arteriovenous malformation, intracranial aneurysm, and there is trauma, hypertension, but the most common cause is a leaking aneurysm. Aneurysm is abnormal dilatation of the blood vessel in the area of the circle of Willis or congenital arteriovenous malformation of the brain. The following are some modifiable risk factors or predisposing factors for ischemic and hemorrhagic stroke. The first one is hypertension. When your blood pressure is 140/90 and above, you are hypertensive and it can lead to stroke. Second one is cardiovascular diseases. These cerebral emboli may originate in the heart. Other heart diseases that can cause this stroke are congestive cardiac failure, arterial fibrillation, coronary artery disease, heart failure, left ventricular hypertrophy, myocardial infarction, especially the anterior one, rheumatic heart disease. The third one is high cholesterol level. It can lead to this stroke. Fourth one is obesity. Fifth one is elevated hemocrites. That is, it increased the risk of this cerebral infarction. Sixth one is diabetes mellitus, associated with accelerated atherogenesis. That is, it leads to the formation of these fatty deposits. Seventh one is, the number 7 is oral contraceptives. It increases risks, especially if you have coexisting hypertension, if you smoke, and if you have a high estrogen level. The 8th one is smoking. If you do smoke a lot, it can lead to stroke. Number 9, drug abuse. If you abuse drug, especially cocaine, you take too much of anticoagulants and amphetamines, it can lead to stroke. Number 10, excessive alcohol consumption can lead to stroke. Time course classification of stroke. We have transient ischemic attack, we have reversible ischemic neurological deficit, we have stroke in evolution, and completed stroke. Let's start with transient ischemic attack. Here, there is temporal episode of neurological dysfunction manifested by sudden loss of motor, sensory, or visual function. This attack lasts for few seconds or minutes, but it doesn't exceed 24 hours. There is complete recovery between attacks. These symptoms now results from temporal impairment of blood flow to a specific region of the brain due to atherosclerosis, obstruction of the cerebral by a small embolus, that is air. If abnormal fatty deposits occlude the blood vessel, or there is air that occlude the artery, which is meant to supply blood to the cerebrum or the brain, and if there is a decrease at which blood passes through the artery to go and supply the brain, or in case of cardiac dysarrhythmia, when there is no enough cardiac output, which now results in irregular pulse and all that. And this transient ischemic attack may serve as a warning of impending stroke, which has its great incidence in the first month after the first attack. Lack of evaluation and treatment of a patient who has experienced previous transient ischemic attack may result in stroke and irreversible deficit, that is complete stroke. Reversible ischemic neurological deficit. The signs and symptoms are consistent but more pronounced than that of transient ischemic attack and last more than 24 hours. Symptoms resolve in days with no permanent neurological deficits. We also have stroke in evolution. There is worsening of neurologic signs and symptoms over several minutes or hours. This is a progressive stroke, as in it's kind of continuous. And the last one is completed stroke. There is stabilization of the neurological signs and symptoms. This indicates no further progression of hypoxic insult to the brain from the particular ischemic attack. As in, everything is completed, is now stabilized, it has come to stay. According to location, we have left hemispheric stroke and right hemispheric stroke. So I'll be showing you guys what happened when someone have right or left hemispheric stroke. Okay, in left hemispheric stroke, there is paralysis or weakness of the right side of the body. There is right visual field deficit, there is aphasia, and there is altered intellectual ability and slow and cautious behavior. But when a person have right hemispheric stroke, there is paralysis on the left side of the body because there is increased distractibility, impulsive behavior and poor judgment, and lack of awareness of deficit. Stroke affects many brain functions. There is motor loss, communication loss, perceptual disturbances, sensory loss, cognitive impairments, and psychological effects. In motor loss, stroke affects upper motor neuron and results in loss of voluntary control over motor movements because the upper motor neuron cross a disturbance of the voluntary motor control on one side of the body may reflect damage to the upper motor neuron on the opposite side of the brain. So the motor losses are, there is hemiplegia, that is paralysis on one side of the body. There is hemiparalysis, which is the weakness of one side of the body. There is flaccid paralysis, which is the initial sign that is showed when someone has this stroke. In communication loss, there is dysarthria, that is difficulty in speaking because there is paralysis of the muscle responsible for producing speech. There is dysphasia or aphasia, that is deficit speech or loss of speech. There is aprasia, that is inability to perform a previously learned action, e.g. you might see a patient picking up a fork and attempt to comb his hair with it. And we have perceptual disturbances, that is, perception is the ability to interpret sensation. The person get to have anosmia, that is loss of half of the visual field. You remember we said if the person have left hemispheric stroke, the right visual field will be lost, or there will be right visual deficits, and vice versa. Sensory loss, there is slight or severe impairment of touch, difficulty in interpreting visual, tactile, and auditory stimuli. In cognitive impairments or psychological effects, because the stroke affects the frontal lobe, there is necrosis of the frontal lobe, so the person gets to have limited attention span. There is difficulty in comprehension, there is forgetfulness, lack of motivation, depression, emotional liability, hostility, frustration, resentment, and lack of cooperation among all signs and symptoms. We also have meningeal irritation. How can stroke be diagnosed? Firstly, a careful history and a complete physical and neurological examination of the airway patency, which may be compromised by gag or cough reflexes and altered respiratory pattern. And we have to check the cardiovascular status, which is the BP, cardiac rhythm, and weight. We also have to check the carotid burette and gross neurological losses, because we said there are some modifiable risk factors that can predispose someone to this stroke, which hypertension is one of them. So that is why we have to check the BP of the person, that is the blood pressure of the person, and we have to carry out non-construct computated tomography, CT scan. It is performed to determine if the event is ischemic or hemorrhagic, and to know the type of stroke it is. Maybe it's kind of there is occlusion or there is bleeding in the brain, to determine the treatment. Another investigation is 12-lead electrocardiogram and a carotid ultrasound. It is done to identify the source of thrombi and emboli, the source of the blood clots or the air circulating in the blood, if it is being found out that it is of ischemic origin. We also have cerebral angiography. We have lumbar puncture if it's of hemorrhagic origin. We also have electroencephalogram for us to monitor for the monitoring of brain waves. It's carotid angiography, which allows visualization of the intracranial and cervical vessel, that is cervical vertebrae vessel, vertebral artery to be specific. Stroke is a very broad topic, so in my next video I'll be discussing the pathophysiology of stroke, both ischemic and hemorrhagic stroke, the prevention, medical and nursing management, and also complication of stroke. see you there. Turn on your notification bell so you are going to know whenever I drop the video. Thanks for watching.